Hi, my name is Matilda. I chose leukemia as my topic. Um, so I did do a board. It's just basically written out what I'm gonna say. Up here is normal blood cells compared to blood cells with leukemia. I also included a sample of the procedure in which they extract some blood, some bone marrow to send out to the lab to test for leukemia. This is what they do a complete blood count, and also one of the treatments over here would include chemotherapy. So, there are four main types of leukemia, which is acute myeloid leukemia, acute lymphocytic leukemia, chronic leukemia, and chronic myeloid leukemia. These types of cancers often form inside the bone marrow or other cells and tissues that form blood cells and are also known as blood cancers. Leukemia results in overproduction of certain kinds of white blood cells, which then circulate into the bloodstream. Leukemia can be chronic or acute. Chronic, a slow growing type of cancer that begins without symptoms, and acute, meaning the cells can't function normally and symptoms progress rapidly. It affects both adults and children and kills more children under the age of 20 than any other cancer. In leukemia, the bone marrow creates abnormal white blood cells that don't mature properly. Therefore, they cannot fight infection effectively and they don't die like normal cells. Instead, they build up in the bone marrow and in the bloodstream. As leukemia progresses, the effects on the body include frequent infections from a lack of unhealthy white blood cells, and anemia from a lack of healthy red blood cells. They also, people who also suffer from leukemia, easily bruise and easily bleed because of inadequate platelets. Death rates are higher among the elderly, with the percent of leukemia deaths highest among people ages 75 to 84. So, how is leukemia diagnosed? Physical examination, the doctor will basically look for pale skin or swelling of the lymph nodes. They also do a complete blood count to test for any abnormal levels of white blood cells and platelets. They also do a bone marrow, which I showed the picture earlier, a bone marrow test. This procedure includes a removal of a small sample of bone marrow, and they extract it from your hip bone. It's removed using a long, thin needle. There are many different treatments of leukemia. All depends on the stage and the level of your cancer and whether or not it has moved to other parts of your body. Your age and your overall health also plays a major role in the type of treatment the doctor feels that is beneficial for you. So I'm going to discuss some treatments. The first one, of course, is chemotherapy. This drug treatment uses chemicals to kill leukemia cells. Depending on the type of leukemia, you may receive a single drug or a combination of drugs to treat the cancer. These drugs come in a pill form or they may be injected directly into your vein. Another treatment will be radiation. Radiation uses x-rays or other high energy beams to damage leukemia cells and stop their growth. Biological therapy, this works by using treatment that helps your immune system recognize and attack leukemia cells. Another one is basically a stem cell transplant. A stem cell transplant is a procedure to replace your diseased bone marrow with healthy bone marrow. But before doing a stem cell transplant, you will have to receive high doses of chemotherapy or radiation therapy to destroy your diseased bone marrow. Then you receive an infusion of blood, forming stem cells that help to rebuild your bone marrow. So that's basically my video. Again, here goes my poster on leukemia. I hope you guys find it informative. Thank you.